Transplant is a miracle of life. Transplant is the ultimate treatment if you have end-stage renal disease or liver disease. It's like a rebirth for these patients. I am the first woman transplant surgeon in the Philippines, and as such, I have helped push the frontier of organ transplant in the Philippines. I have been in transplantation for more than 30 years, actually going on 35 years now. I have witnessed my father in public service. He was a doctor, practically to a very small town in South Cotabato. Alam mo naman doon, public service talaga yon. I have witnessed that and I have helped my father. And I trained in a public hospital, Philippine General Hospital. Very, very, very public. I could have gone to the US. I passed naman lahat ng exams, but then it was like a bandwagon. Exam lang tayo ng exam. But I never really thought of going abroad permanently like my other classmates did. I just wanted training. That's what I did. Although I was enticed to be in a private hospital again as full-time, I declined because I wanted to stay here at NKTI. Because I saw lots of patients. That time, maski 30 years ago, makikita mo na parami ng parami ang pasyente yung have kidney problem. I believe mas nagugustuhan ko yung I have served here. You know, I had an 11-month-old baby na na-transplant ko. So if you imagine na lamang yung parents having this baby on dialysis for the rest of the baby's life. I have a story of a patient who had 3 transplants. So, you see, this patient lived for so many years, since 1996 after the 3rd transplant. That was the longest time. So these are people who have really inspired me to love transplantation because it changes the life of the patients. There is the universal healthcare, and I am with the TWG on the framing of this stratified framework for the renal health. Even if I will not be a director anymore in the future, I want to help continue with this project in the universal healthcare. Because in this stratified framework, you start with the barangay. You train people there also to make aware the population of how to take care of their kidneys. I hope with this UHC, hindi na maraming tao magkakaroon ng renal failure kasi you can take care of them even at the barangay level pa lang. I believe I have inspired surgeons to become transplant surgeons and doctors to be engaged with transplantation in this hospital. And of course, having the right people. Na-inspire ka din, di ba? Because you bring out the best of your people in this institute. Ako po si Dr. Rosemary o Rosete Liquete, Executive Director of the National Kidney and Transplant Institute. Gawin po nating lingkod bayani ang ating mga kawani.